Hello and welcome to our show, Health and Wellness Myths and Facts. For a long, women's health has sadly not received attention due to a variety of reasons. Primarily among them is the tendency of women to keep their health needs at the bottom of their priority list. She always prioritizes the health of her father, her brother, husband and kids before taking care of herself. While doing this, it frequently happens that the health issues in women are generally diagnosed when they have escalated from the basic stage. This makes it more difficult to manage and control these conditions. It's imperative that women's health is given due focus and attention so that the overall health of the family remains well. Today we have a panel of experts who will discuss women's health in detail. If you have any questions you would like to ask them, send them to us via WhatsApp on the following number. That's +91 916 766941. That's the number to send us your questions, and to our experts, do also send us your name as well as your location. So today we have with us Dr. Niti Aggarwal, Senior Consultant, Max Super Speciality Hospital, PPG and Vaishali. We also have Dr. Sonali Kagne, Consultant Diabetologist, and this is Dr. Sonali's Diabetes, Thyroid and Endocrine Clinic Honorary Consultant at the Aditya Birla Memorial Hospital in Pune. Dr. Anushree Mehta, Consultant Diabetologist, and Dr. Anushree Mehta's Gluco Care and Control in Mumbai. A very good afternoon to all you doctors. Thank you so much for joining us here at NDTV. Let me begin with Dr. Kagne first. Doctor, women experience unique health issues and conditions from pregnancy and menopause to other gynecological conditions as well. These cause hormonal variations and would predispose women to more health challenges. Could you enlighten us on these, Dr. Sonali Kagne?
Yeah. Sure. Women do experience a lot of health issues because of the hormonal problems, and at various different stages of their life. So during the childhood, they may face problems like early onset of periods, or the delayed onset of puberty, delayed onset of periods. Adults and girls face problems of irregular menses, polycystic ovarian syndrome, hirsutism, that is development of abnormal hair on the face, chest or abdomen. And adult women may have issues with the fertility, recurrent abortions. They have problems with sustaining their pregnancy for a longer period of time, and they need hormonal supplements for that. They may have worsening of their thyroid function during pregnancy. They may develop new onset diabetes during pregnancy. And after that, at a later stage, some women, although very few in number, they also experience early menopause at the age of their 40s or 30s, and sometimes even in their 20s.
Right.
Again, around the time of menopause, they face problems like hot flashes, irritability, vaginal dryness. Sometimes these symptoms are so severe that they need to be on hormone replacement therapy for a certain period in time. Again, this menopause decreases the level of female hormone, that is estrogen, in women dramatically. This estrogen is very important for maintaining the bone health. Therefore, after menopause, women are more susceptible for the development of weak bones or fragile bones, what we call as osteoporosis. Therefore, all women in this postmenopausal age group must take calcium, adequate amount of calcium and vitamin D through the diet as well as through their supplements in order to prevent the osteoporosis and the future risk of fractures.
Right.
I would also like to say that along with this, when they are facing these hormonal problems, they not only experience the physical pain, but they also go through immense psychological stress. Therefore, it is very important for them that these conditions are diagnosed in time so that the future complications are prevented.
Right. Moving on to my next question. Weight gain in pregnancy varies greatly, and most women struggle to get rid of that extra weight post-delivery of the baby. Does being obese during pregnancy put a woman at risk of future problems as far as their health is concerned? Dr. Anushree Mehta, if you could answer that question.
Yes, thank you for the question. Definitely. When you gain weight during pregnancy, it is very common that most women gain weight during pregnancy, and if they are not able to lose weight post-pregnancy and they become obese, then that definitely increases your risk for developing several metabolic health problems like diabetes, blood pressure, heart-related problems. It also increases risk of developing mechanical problems like osteoarthritis, back issues. It affects the overall fitness, it affects the overall quality of life, it affects well-being of the woman, you know. So you have to be very, very careful about, making sure to lose the weight that you've gained during pregnancy. You should follow healthy lifestyle choices and make sure to do regular physical activity so as to prevent your risk of developing such illnesses in the future.
Right. Bringing me to my next question. If a woman is overweight, will losing the excess weight help her to better manage lifestyle diseases like PCOS and type 2 diabetes? Dr. Niti Aggarwal, if you could take that question.
Yes, thank you. Divya, obviously it is logical, like my previous panelist told, that if there is increased weight, there is increased risk of lifestyle and mechanical issues. So it is a logical conclusion that if we lose that extra weight, there will be improvement in these metabolic disorders. So in fact, we need to understand that the basic pathology is of insulin resistance. So any weight loss, it has been found that this weight loss will improve the insulin resistance. It will bring down the resistance. So metabolism will improve. So it has been seen that if the patient actually loses some weight, even less than 5%, then there are chances of improvement in the blood pressure and the triglyceride levels. So that triglyceride means the bad cholesterol levels. About 5 to 10% weight loss weight actually improve the diabetes. So any 5% weight loss improves the HbA1c, which is the 3-month average sugar, by around 1%, which is very significant.
Right.
10 to 15% weight loss, like Madam just said, would also improve the mechanical complications. The periods would become normal in PCOS women. The osteoarthritis would improve. The non-alcoholic fatty liver disease will improve. More than 15% weight loss, in fact, can induce diabetes remission. So whatever weight loss we may be able to achieve would ultimately help us metabolically.
Right, doctor.
So yes, definitely weight loss will help, and any weight loss will help.
Right. Now, bringing me to the next question, we were talking about PCOS. One of the bigger issues facing women is PCOS or PCOD. What is the difference between the two? What are the causes for it, and what steps can be taken to reduce the risk of getting them? Are women with PCOS more at risk of developing diabetes? Dr. Sonali Kagne, if you could answer that question.
Yeah, sure. Actually, PCO, that is polycystic ovary, just generally means presence of multiple cysts in the ovary. Okay, this polycystic ovary or polycystic ovarian morphology can be seen in various disorders like hypothyroidism, hyperprolactinemia, and other rare hormonal disorders. But for the diagnosis of polycystic ovarian syndrome, which is also commonly known as polycystic ovarian disease, we need to have at least 2 of the following 3 criteria, such as absent or chronically irregular periods, presence of signs of high level of male hormones in females, such as acne, oily skin, hirsutism, that is abnormal hair on the face, chest or abdomen, and ultrasound evidence of multicystic ovaries. Okay, the exact cause of this polycystic ovarian syndrome is not known. However, the complex interaction between genetic factors and the environmental factors may play a role in having this disease. Generally, women produce very minimal amount of male hormone, whereas females with PCOS, either they produce more amount of male hormone or they are more sensitive to the male hormone. That is the reason they get irregular periods and decrease in ovulation, as well as the signs of male hormone excess. Along with that, as Dr. Niti Madam has already explained, that these women are also, a majority of these women, whether they are obese or non-obese, they have underlying insulin resistance. And that answers the question that women with PCOS are twice more likely to develop gestational diabetes mellitus because of the underlying insulin resistance. Coming to the question that whether we can reduce this risk of PCOS, is that as there is genetic predisposition, we cannot change it. However, if we adopt a healthy lifestyle and if we can maintain the healthy normal weight for their height, then these problems can be, the symptoms severity can be reduced and the further complications can be reduced, because weight loss reduces the insulin resistance. Decrease in insulin also leads to decrease in male hormone level, and it will regularize the period, it will induce the ovulation, it will prevent the chances of infertility in women.
Right. Thank you so much for answering that question. My next question is for Dr. Anushree Mehta. Now, diabetes can affect people of any age, race or sex. It can affect people with any lifestyle. Are risk factors of diabetes different in women from those in men? Dr. Anushree Mehta?
Yeah. So I think we already talked about PCOS, which is a risk factor which is very, very specific to women when it comes to diabetes. The general risk factors per se would remain same, like excess weight or family history or poor lifestyle. But when we talk about women, there are two very important risk factors that we have to consider. One is that if the woman has had a history of gestational diabetes, that is, she has had diabetes during pregnancy. And the second is if the woman has a history of giving birth to a child with a high birth weight of greater than 9 pounds, then such women are at a much higher risk of developing diabetes in the future. In fact, if you look at their 10-year risk of developing diabetes, then it is almost 50%. So this is a very, very important group of women. If you have history of gestational diabetes, then you should make sure that after delivery at 6 weeks, and then at least yearly, if not yearly, then at least every 3 years, you check your blood sugars to make sure that you have not developed diabetes. Most women take a lot of care of themselves during the pregnancy, because they want a healthy child, they want a healthy delivery. But what happens is that after delivery, all of their effort goes in bringing up the child, and their health takes a back seat, and that is where a lot of time is lost, and many a times they come only when they are diagnosed with diabetes. But if they are able to monitor themselves regularly, and they are able to keep a check and make sure that they are diagnosed at the time of pre-diabetes or when they are at borderline, then they can actually make efforts to push or delay the onset or even reverse their diabetes with much less effort than it would be if they develop frank diabetes. So
Right.
if we talk about women, I think gestational diabetes is a very, very important risk factor that everybody should know about.
Thank you so much
Thank
for
you.
answering that question. Moving on to Dr. Niti Aggarwal. Is it true that females with diabetes often have more serious complications and a greater risk of a death than men? Dr. Niti Aggarwal?
Yes, and it is a fact. Like Dr. Anushree said, women are the neglected lot. So the risk of mortality, death, which means versus men in women with diabetes is about 17% higher. And similarly, the risk of cardiovascular death is also around 75 to 85% higher in women. See, as you just spoke a little while back, women will take care of their families, the brother, the father, the husband, the son. So it has been seen that women are diagnosed with diabetes much later. So they have a higher period, higher duration of time when they remain uncontrolled. The glycemic control, the sugar control is much higher. The sugar level is much higher in women for a longer duration of time. So the risk of complications is much higher. Also, this is one part is diagnosis. The second is access to healthcare. Once diagnosed, the treatment, the target achievement, the glycemic level, they are not attained. They do not receive the kind of care which men receive. So therefore, ultimately, there is a higher risk of complications. Also, there are the hormonal differences. There is a higher body mass index in women. They are higher levels of blood pressure. They have higher levels of lipids. So they are generally more prone to developing complications. Also, the likelihood of taking aspirin, which is kind of preventive for cardiovascular complications, is less. So women definitely have a higher risk of complications and death versus men when they have the same level of diabetes.
Right. Thank you so much, Doctor, for answering that question. But if you have any more questions you would like to ask, then send them to us via WhatsApp to the following number. That's +91 916 7666 941. This is the number you can send all your questions. Please send us your name as well as your location. With that, we're sitting a very short break. Lots more coming up on the other side. Welcome back to our special show, Health and Wellness Myths and Facts. We have Dr. Mehta, Dr. Kagne and Dr. Aggarwal still with us. Now, let me take a question to Dr. Kagne. Thyroid disorders are more common in women than in men. There are many types of thyroid dysfunctions. Which type of thyroid disorders are more common in women? And also, what are the symptoms that we can pick on? Dr. Sonali Kagne, please answer that.
Yeah. Thyroid dysfunction can be divided into structural dysfunction or functional dysfunction. So the structural problems with thyroid is that there can be enlargement of the thyroid gland, which we call it as goiter. If the entire thyroid gland enlarges, it is called as diffuse goiter. If a part of the thyroid gland enlarges in the form of a single nodule, it is called solitary nodule. If there are multiple nodules, then it is called as multinodular goiter. This structural abnormality can be associated with normal thyroid function or abnormal thyroid function. Coming to the functional abnormalities, the thyroid can underfunction, which we call it as hypothyroidism, as seen in most commonly in Hashimoto's thyroiditis, or the thyroid can hyperfunction, which is seen in Graves' disease, or toxic adenoma, or toxic multinodular goiter. So in general, all these structural and functional abnormalities of the thyroid are almost 3 to 10 times more common in women as compared with the men. Coming to the symptoms, this goiter or enlargement of the thyroid gland many a times does not produce any symptom, and it is accidentally detected by patient or the relatives. Whereas if the goiter is bigger, it can be cosmetically unacceptable, or it may cause pressure symptoms like difficulty in breathing, difficulty in swallowing, neck tightness, choking sensation, etc. Coming to the hypothyroidism, which is underfunctioning of the thyroid gland, the symptoms can be fatigue, lethargy, lack of interest in the work, memory deficit, irritability, depression, feeling of extra cold, excessive sleepiness, muscle pain, joint pain, hair loss, dry skin, dry hair, puffy face, weight gain, constipation, bloated abdomen, loss of appetite. Also, women can experience irregular and heavy menstrual bleeding, as well as up to certain extent, the hypothyroidism can contribute to infertility or recurrent spontaneous miscarriages in women. Whereas the symptoms of hyperthyroidism are anxiety, nervousness, insomnia, weight loss, palpitations, that is racing, bounding heart, increased sweating in them, hair loss, short menses, dry hair, hair fall, etc. So any combination of these symptoms can be present in with varying severity in patients with abnormal thyroid function, and especially thyroid dysfunction during pregnancy may affect the baby. Therefore, it is very important for a woman to get the thyroid test done as soon as she knows that she is pregnant.
Right. Thank you so much, Doctor. My next question is for Dr. Mehta. Women frequently suffer from vitamin D deficiency. This may result in brittle bones. Does it also have a relation with an increase in the risk of diabetes? Doctor?
So vitamin D deficiency and diabetes actually have a very complex relationship. It's like a chicken and egg situation, we don't know which comes first or later. There is a lot about this association that we know, and there is a lot about the association that we still do not know. But yes, vitamin D deficiency does increase your risk of diabetes. It increases your risk, or there is an association with increased risk with a host of other diseases also. So you have to make sure that your vitamin D levels are optimum. And when I say optimum, I mean they should be in the normal range. You should not be consuming excess vitamin D also. So you should, make sure to get your vitamin D levels done at your yearly checkup, because not only does it help reduce risk of brittle bones, as you've mentioned, but it also helps you to reduce risk of other diseases as well, including diabetes.
Right, thank you so much, Doctor. My next question is for Dr. Aggarwal. Women are more at risk of developing osteoporosis. Does osteoporosis get aggravated after menopause? Dr. Niti Aggarwal.
Yes. So osteoporosis, there is a specific entity which is called as postmenopausal osteoporosis. So which means that after menopause, there is a greater risk of women to develop osteoporosis, means weak brittle bones. In fact, this is the most common type of osteoporosis which is encountered. 50% of the women, they have over the age of 50 years are prone, they are at risk of developing osteoporosis. Now what happens is there is a gradual bone loss which is happening because there is estrogen which was preventing the bone loss, which is withdrawn after menopause. So there is an increased bone turnover. So the bones, they become more fragile. They are more porosity, means the porous nature of the bones increases. There is thinning of the bone. So the women become more prone to developing fractures. So they develop more commonly the wrist fractures, the hip fractures, and the spinal fractures. It is very important that the osteoporosis be prevented in the post-menopause. So it is important that the women consume a healthy diet which is rich in calcium. As my previous panelist said, vitamin D supplementation which is adequate, regular exercise, and fall prevention. Knowledge of the fact that preventing a fall will prevent a fracture is very important. Also, women should avoid smoking in the menopause. So that way the fractures can be prevented. Also, screening becomes very important. Doing a DEXA scan at the annual health check is important to diagnose. Only if we know we can treat. There are good drugs to manage and treat osteoporosis, especially the postmenopausal osteoporosis. So diagnosis is very important.
Right. Thank you so much, Dr. Aggarwal and Dr. Mehta, along with Dr. Kagne, for joining us on the panel today. Well, if you have any questions you would like to ask, send us your questions via WhatsApp to the following number. That's +091 9167 666 941. That's the number you can send our questions to for our experts. Do also send us your name and your location. Thank you so much for your time.